Hi class, my name is Lexi and today I'm doing my presentation on mononucleosis. So mononucleosis, mono for short, is caused by the Epstein-Barr virus. I am choosing to do my presentation on this because it did affect me about 2 years ago. I got a very severe case of it, and I want to educate you guys on the signs and symptoms and what to look out for because it can be a very serious illness if you don't keep an eye on it. So mono is generally prevalent in the younger age groups. So high school and college students, it is known as the kissing disease. It's spread through blood and saliva, so hence the kissing disease. I actually got it. I got COVID, and then right after I had COVID, I got mono, which I did do some research, and it did say that a lot of the Epstein-Barr virus, mono, flares up after people have COVID. So the weird thing about the Epstein-Barr virus is once you're infected with it, it can lay dormant in you for the rest of your life, and it'll flare up at certain times. So I was super sick with COVID, my immune system was down, the mono flared up, and that was the first time I really had a real signs and symptoms of it. There are pretty harsh symptoms. They include extreme fatigue, swollen lymph nodes on neck and armpits, headache, skin rash, soft swollen spleen, sore throat, swollen tonsils. The bad thing about mono is that your spleen does get enlarged, and that can lead to a ruptured spleen. So if you do have mono, you really want to keep an eye on that because a ruptured spleen is not good. I know when I had it, my tonsils got so swollen that my throat was literally closing. I had to go to the ER for it and get steroid shots and numbing cream because I couldn't even swallow my own spit. It was so bad. I also had extremely swollen eyelids and face. Like my whole face looked like I got stung by a bee. And it's just strange because I had friends who also had it and they didn't have as bad as symptoms. So it just affects each person differently. Oftentimes mono is misdiagnosed as strep. So you do get little white dots most of the time on your little tonsils, and that makes doctors think it is strep, so then they might prescribe an antibiotic. And the weird thing about mono is that it totally does not respond well to antibiotics. So you'll get covered in a rash if you take antibiotics while on mono. Doctors, if they think it's severe enough, they will give steroid shots, which is what I got in my case. The duration of the illness kind of varies person to person. When it comes to the fatigue can last months or it can last weeks. The actual symptoms normally last to about 2 weeks of like swollenness, sore throat, things like that. But the fatigue can last months after. So in my case, when I had it, I couldn't walk up the stairs without needing to stop for 4 months after I had it. And it says, I have some facts here. Generally, 20% of patients can return to school or work within 1 week and 50% within 2 weeks. Fatigue may persist for several more weeks or in 10% of cases for months. So this can really affect your life. It can affect